Go ahead and get started. For those of you that I haven't met, I'm Warren Kisker. I'm director of the Hart Career Center here at the university. I'd like to welcome all of you out at what I know is a busy time of the year for everyone. And I'd like to thank our panel for joining us for what is no doubt a busy day every day. A few public service announcements before we get started. I'd like to thank Tri Beta for co-sponsoring this evening's event. You have a bio that you picked up, so I'm going to ask our guests to introduce themselves. It'll be part of the questions that we have for them this evening. But in the bio, it does include some information that they may or may not touch on. So hopefully you picked that up as you were coming in. I'd like to introduce and thank Patrick Zajac, who's in the back of the room, because Patrick is our event planning coordinator and did a lot of the heavy lifting in planning this evening's event. Unfortunately, Don Willard, who is the physical therapist that was planning to join us, is ill, and so he won't be with us tonight. I will tell you that he has been wonderful about letting students come in and shadow. So if any of you are interested in meeting him, shadowing, that opportunity can be arranged. So just see one of our staff and we'll take care of that for you. I'd also like to take this opportunity to introduce, we have a newly created position, and this will probably come as news to some of our panelists as well. A position that I think has been long overdue. It is, I'm going to read this so I get it straight, because it's a mouthful: biology and pre-health career advisor. And I see some puzzled looks here, so I'm guessing that many of you are not aware of this. But Michelle Darnell, who has been a longtime employee of Illinois Wesleyan, will be joining our office and also the CNS. She's going to be dividing her time in her responsibilities and working with our students in all pre-health areas. So we're thrilled that there's going to be one point person to kind of guide students as they get started. And I think our students are going to benefit tremendously from that as well. And I think on that note, seems like there was one other thing I wanted to mention, but it'll come back to me. So the way we're going to handle this is all of our panelists received a list of questions. I looked at it and thought, there is no way we're going to get through all these questions. So I'm going to work my way through about half of those. And then I'm hoping that all of you have questions as well. So typically at our panels, you have a chance to ask questions during or directly following the panel, and then many of you know that you have an opportunity for our guests who can stay for a little while to ask individual questions that maybe you haven't thought of during the course of the presentation. But because they will be introducing themselves, I'm going to start by asking each of them to tell us a little bit about your career path from undergraduate preparation, your major campus involvement, so we get to know a little bit about what you were engaged in, into professional school, and then take us from that point up to your current professional work. And this can begin in any order. So, and this doesn't look like a group that's going to need instruction here. So jump in here, folks. Well, maybe I'm wrong.
As the senior panelist here, they've all pointed out. I am Nicholle Eisfelder, or Nikki. I grew up around here. I graduated in '95. I'm an occupational therapist. I was a cheerleader while I was here. I was in the Greek system. I went from here as a natural science major. I started as a bio major and then switched to natural science and did bio and psych as my major and chem and physics as my minor. And I went to WashU. At that time, there was a 3-2 program. I don't know if that's still active. I did not want to skip my senior year of college because that seemed silly. So I stayed and went the traditional 4-year and then went on to WashU and got my master's. I did my thesis work in brain injury and thought that's where I was going to go. I'm an author of the MEAD test, which is a test of fine motor and mental deficits after a brain injury. That it was a lacking subset, and WashU really guided you towards more academics and applying it to your field. And then I had a hand surgeon say, hey, come work for me, I'll teach you everything you need to know. And I said, all right, what's a year of my life? I'll move to Chicago and do that. And I did that, and it's been 20 years. And I do hands. I'm a certified hand therapist on top of being an occupational therapist, and I work at McLean County Orthopedics with that guy at the end. How's that? Did I answer the questions?
You did,
All right.
perfectly. You don't have to say that graduation year so quiet, because there's those of us who feel quite old, so.
Well, there's few of us.
I'm Annie Nord. I'm a dentist here in Bloomington. I grew up here and I was in the class of 2013. I was a biology major and a Spanish minor. I was on the tennis team for 2 years. I was in Kappa Kappa Gamma sorority. I studied abroad in, what are you wearing? I studied abroad in the Galapagos Islands, and I went to Honduras twice with the Global Medical Brigades. Trying to think what else I did at Wesleyan. And then I went on to dental school in Southern Illinois, University in Alton, Illinois. I just graduated in June, and I bought a dental practice here in September, so I've been owning my own dental practice for 6 months now.
Annie, would you say that that is common?
No. I was the only one in my class that bought a dental practice.
Well, my name is Mary Stapel, and I graduated in both boards, actually, some years after. And I'm from a little town over near Tewan called Tewan. And I feel like I was not very active as much at Wesleyan because I had figured out I could finish in 3 years, so I kind of just put my head down and got through that. But then because of that, and of course, as you guys know, applying for med school takes a year after you take your MCAT. So I did a year master's program at Dartmouth in the evaluative clinical sciences and had a focus on quality improvement. I think that was a really kind of fantastic view of, big picture view of health systems and medicine from the outset. But then I trained in the rural med program at U of I in Rockford, and kind of always knew I wanted to do something in underserved medicine. Trained in the residency at U of I in Peoria and did internal medicine pediatrics. And I've had the opportunity to do some global health work, which is kind of my passion. And so I feel like I've had a really neat opportunity to work in a way where I practice half time with my own patients, and then I spend the other half of my job both teaching and then working on building our global and rural health program for both the medical school and the residency. So we work on developing a lot of sustainable partnerships and doing work in that way. So I feel really blessed that I've had those opportunities.
I feel kind of like a poser. I did not graduate from Wesleyan. My sister did, though. She graduated in 2010. Warren has known me and my family for a long time. He and my mother went to high school together, and I graduated, this flies, I'm sorry, I graduated from PA school in 2011. I graduated from Illinois College in 2008. I double majored in biology and chemistry, and I ran track and pole vaulted for 3 years until you had to take 4 lab classes in 1 semester, and then that just got to be a little too much. Let's see, and then I took a year off between undergrad in PA school. I went to PA school at Des Moines University in Iowa, and came home, practiced in general surgery for 2 years, got married, moved to Monticello, and I've been in orthopedics ever since. And that's, love hand surgery. That's my favorite.
I'm Richard. My name is Joe Norris. I graduated Wesleyan in '99. I came to Wesleyan knowing I was going to teach and coach, 100% sure. And the first day, I don't know if anybody had the privilege of meeting Bruce Criley in this group. I don't think so. Oh, we did, but in the students. Bruce Criley ran the biology department here for decades, and the first day, it was classic. It was, Wesleyan to me was medical school for the teen-year-olds because he flew here, got a perfect on her ACT. And as far as I could tell, everybody raised their hand. I don't know, I didn't. And then flew here, you know, was at auditorium. It was, and who here is going to go to medical school? And I was like, I just want to teach. No, shut up. But it made me start thinking about practicing the art of science and what can I do to do that outside of teaching. And quite frankly, Wesleyan was so dang hard. I was like, I want to get through all this. Like, I can still teach, even if I go to medical school, which I want to do every day. So I went through Illinois Wesleyan, was in the social fraternity, played football for 4 years. After Wesleyan, I went to Southern Illinois University for medical school, and then I went and did an orthopedic surgery residency, and then after residency, I did a fellowship in sports medicine. So after a lot of orthopedic residencies, you do a year of specialization. I went to Baltimore, Maryland, and worked with some professional team, the NFL team, and Johns Hopkins, and a few, just to get a flavor for dealing with athletes. And then I moved straight from Baltimore to Bloomington in '09. It's been a dream ever since. I will say that Wesleyan, I'm sure everyone except Annie, because she's a poser, would give the same sentiment. The reason that I got to do what I do is because I chose Wesleyan. You know, I didn't blow tests out of the water, but I got everywhere I needed to go. And it started with knowing that when I went to med school, believe me, when you get there, if you've been through this curriculum, it's not a problem. I mean, it's not easy, but it is. It was the best decision I made, and I had to start early. So I have a lot of pride and a lot of interest in helping you for Wesleyan.
Well, if Don Willard were here, he would also be a poser. So my next question was originally going to be for 4 of our 5 panelists, but I'm going to open it up. I happen to know that Annie went to Illinois College because her mother had a sweatshirt that had Illinois Wesleyan on one side and Illinois College on the other side. So I'm going to ask each of you to speak to your undergraduate careers and how that prepared you for your professional work. What were the things that stand out for you that you would suggest our students take advantage of to get to where they hope to be? And I'm going to ask Dr. Norris to start.
Okay. Well, like I said, you know, Wesleyan, by the time I got to medical school, did you have Dr. Griffiths?
Mm-hmm.
So Griffiths for histology, Hip and Steel for physiology, and then Criley for embryo. I mean, the all-star cast, you know, at the time, I didn't know if I could get through it. I thought about transferring. I had, you know, some tough stuff in our family while I was at Wesleyan. But, you know, the tough stuff at Wesleyan where I worked, I had to work hard, and I think even a genius has to work hard at Wesleyan to do really well. And so the work ethic was number one. I mean, it's Saturday, I gotta go to the library. This wasn't a big change for me, you know, especially playing football. You gotta really prioritize what is important and how to manage your time. And that time management, as you hear it, but you don't believe it because you're in college. But time is your biggest commodity. And Wesleyan taught me that before I got to medical school. I think that's number one. Number two is they just taught me content. We could have made a lot of money tutoring histology at my medical school. Because they would say something and be like, you're wrong. That is not right. I would argue about it because it literally took stuff off my plate. The first year, a hip and steel physiology test blows most of what I had to take out of water in medical school. For the first year. Now, I don't want to, like, again, this was not like a free ride. Wesleyan to MD, let's start doing surgery. But the content and the rigors, it's worth it. You know, it really is. I have my attending and program director of my orthopedic residency, his son came to Wesleyan for one semester. And he realized that he could never go to medical school if he went to Wesleyan because it's just great that he never be doing that. So he transferred to another school, which was also, I think it was, I don't want to disparage it. No, it was, yeah, it's Illinois College. I think it was Loyola. And I'm like, oh, I thought that was a great school too. But either way, I think that be really confident that what you're doing now is hard, but it's totally worth it. Put front load the work. And then you know what hard work is all about. And today, I mean, I got up at 5 a.m. this morning, kids, this, that, after work, to surgery, whatever. It's just, I've been doing it since I was 18, and it feels good. It feels good to feel like you get some stuff done. As I'm sure you guys get stuff done all the time.
Well, I think that these private small colleges are where it's at. This is where you are going to get one-on-one help from your professors. That saved me in college because I'm not a genius. I worked hard, I studied hard, I made note cards, a lot of note cards, and you know, it just to have these professors who actually care about you and care about your future. And maybe steered me in the right direction. My advisor was also my microbiology teacher, my cell and molecular teacher, and she told me I was crazy for wanting to be a chiropractor. She said, no, I don't think that that's going to fit you. What do you think of physician assistant? And I said, what the heck is that? And she got me going the way that I needed to go. And I think, again, you're not going to, and maybe you do. I didn't go to a U of I or an ISU. Maybe you do get that one-on-one attention and help. But you know, these people are here to make it hard for you, but they're here to do that so you succeed. And it's pretty obvious. And I think that you get that here at Wesleyan, absolutely. So what you need to do is use them, utilize the what did you call it? A dream team? Yep, I had a dream team. And I went to my head of the biology chemistry department was Zvi Pasman, and I think he's still there. And I said, what can I do to make myself look better for PA schools? And he said, get in on my research project. And so I did. Spent a summer after senior year, and I don't even remember what I did. Just did a lot of measuring and making petri dishes, which was, but I got my name on paper, and I can say that now, and it's because I asked, and because I wanted to make myself more attractive to PA schools. I wanted to be that person that they wanted, and it's because I asked. So I tell you, just ask.
Well, I feel like you totally said it well in terms of my experience here, having interaction. And my brother went here soon after me and was actually pre-vet school and was now in the military. But I remember him saying he went and talked to Dr. Criley after a rough test and had him sit and listen to opera for a while. So I think the thing for me outside of what you already mentioned is that I think what's so neat about Wesleyan is that, I do think the liberal arts part of it is important, and not to sound like too much away from the science of it, but I think for me, some of the courses that were really valuable were the courses that kind of opened my eyes to other things going on in the world, like taking some English courses or things, in a completely other department that challenged me to think about the world as a little bit of a bigger place than just what it can feel like when you're in the midst of school. And that really continues through medical school, it continues through whatever kind of school you go to, and all the different pieces. It's really easy to kind of feel like things are right here and they're just right now. And I think being able to look outside of that and see that the world is a really big place, and there are a lot of cool opportunities to work in health in general. I think any aspect of health. So I think my encouragement to you would be to try to continue to think widely, think broadly and innovatively, and think of things that, maybe being a physician isn't the right path, because maybe there are some really cool things you could do in, biomedical engineering or something. So, I think there's just, Wesleyan brings that full picture to you, which is nice. I would say take those opportunities as well.
I wanted to agree with pretty much what everyone's saying so far, that Wesleyan was very hard for me. I was one of those valedictorians that was smart, but then I failed my first biology test and thought I wasn't going to be a bio major anymore, and I had to overcome that and learn how to spend nights at the library. And I think, do you guys have Dr. Hickensteel still? No? Okay, so they don't know what we're talking about. He had tests that were, you had to write paragraphs, and if you didn't have every single point that he wanted you to have, you were going to fail the test. And dental school, for me at least, was a lot of multiple choice. So I felt really prepared. I overstudied for everything, just because I was very prepared from coming from Wesleyan.
They got it.
They said, all right, perfect. Okay, we're gonna shift gears a little bit, because I think our group is probably at different stages in their process. So can you speak to the application process for your programs? And I know that things do change, but any advice or guidance that you would have for students who are applying to programs in your field? And I'm going to let you decide who starts here.
Well, who do we have in here? Is everybody pre-med? Who's physician assistant? Who's
How many
thinking
pre-med?
allied health, therapy?
Okay, how many dental? Okay, physician assistant. Occupational therapist. Okay, so there's our breakdown.
Physical therapy, is anybody else therapy at all?
Probably,
Like,
yes.
the processes are the same. And I would say my advice to you at this point is, while you're very focused on the academic part of it, go see all that you can. Watch as many people, go visit. If you think you want to be a therapist, go look at what a PA does, because this is it. You didn't know when you were 17, but now 20, you got to make your decisions. And I think that that's invaluable. You think you know what a profession does until you actually spend a day or even an hour. Come, use us, use your community, use the resources of Wesleyan to see what a person does, because my experience is what you think you want to do is maybe not exactly what you end up doing.
And that's what the schools think too. They want to know that you have done your research and that you are serious about the career that you're choosing. Because if you want to be a dentist, for example, but you never even shadowed a dentist, they might not choose you to go to their school because they don't want you to drop out of dental school.
The only thing I would add is just get in. Leave all your dignity and shame at the door. I shotgunned 25 applications, I think. I mean, it doesn't matter. If you get in, you get in. You know what they call that guy that graduates last in dental class is doctor. And it's the same thing with orthopedic residency. I was trying to go after one of the most competitive residencies, and I was like, send me to Shreveport. Whatever you gotta do, get in, because, you know, you'll make the most of your education, and it doesn't matter. The good news is, at least from the medical point of view, is you have 6 medical schools when I was in Illinois. There's no other state that has that except California and maybe New York. Most states only have 1. So you really have the odds in your favor. So it's great. It's one of the few things I'd say it's great to live in Illinois. But yeah, just get in, figure out a way.
I think research was important too when I was applying for schools, because they asked a lot about that. I did do research here, but they really wanted to know that, and they wanted to know if I was going to do research in dental school, because they were all about that in school there too.
I think if you make your interview more like a conversation, it's a little more natural, and you do research, you know, obviously you visit your school that you want to apply to, and you do research on the school that you want to apply to. And it'll actively engage you in that conversation that you're having with your interviewers. But to touch on what Nikki said, yes, definitely shadow who you think you want to be or what you think you want to be. It just took one day with Dr. Trinovich, and that was it. I just said, no, you know, chiropractic is not for me. Now, he is an excellent chiropractor here in town. I still go to him on the regular, but you know, we had a really good talk and just sort of what I wanted out of life, and it was a very candid, very much needed talk. And then when I came back and talked to my advisor Penny, and she said, yeah, chiropractic is not for you, let's talk PA. And lo and behold, I had been going to a PA, Dr. Harris, my whole life. I had no idea that he was a PA, and that sealed the deal for me. And then, you know, visiting different PA schools obviously helped as well. But I felt like my interview went great, especially at Des Moines University, because I made that more of a conversation than a question and answer. That was a little easier because that was the only one-on-one. They have group interviews, which I don't know if they did for you all, but that was weird.
All right, you touched on the interview. I'm going to press you a little bit. Can you speak to essays? Any advice about things to include, things to avoid, that you would share with the students who are working on these? I read a lot of these.
Mine was bad. I think I was a little too honest. Yeah. Nobody told me it was bad, but like I remember finding it a couple of years ago, and I read it. I was like, oh, it's terrible. Anyway.
And yet here you are.
To your point of researching schools and the fact that you have to lose all your digging, not really, but I decided that I obviously would never lie, but SIU has an interest in downstate residents to fulfill their mission of creating family practitioners within Central Illinois. And at that time, I felt that would could prescribe me. So I definitely put an essay with that little bent on it. I'm from Taylorville. I'm from a small town, and I'm interested in small towns, and I really want to take care of it, because I did, and everything was true. But I think that it took some forethought, and I changed my essay for different schools. I would love to go to Boston College because I love research. I do. If it was presented to me in a way that would find interesting, and I have a lot of interest. But I mean, like I said, I don't want to act like this was dirty or a dirty pool, but you gotta know what they're looking for, and it's a bit of a game. I hate it. I hate that it's a game. Everyone here, I'm sure, is very well qualified. And I was saying before we started that, we had 14 kids from my class in SIU's med school class. They all went together. But I'm sure you had too. I had 5 guys that I knew that didn't get in the year before my year, and I'm like, how did I get in? You didn't get in. And it was a little bit of a crapshoot, and not to be scary about it, but I think you have to a little bit of play the game, in my opinion. And that's what I tried to do as best as I could, knowing what they were looking for, and never getting outside the bounds of what's true, but.
And I think, maybe just to add to that, I think, if by chance you end up not going through traditionally, like if you would not graduate and go straight to school, go straight to whatever professional school you're thinking, I actually think that's not a bad thing in most cases. I think it's a good thing, because I think if you have something on your application that's different than just the traditional student that goes straight through, not to discourage you from doing that, because time is time, and you don't, but I know, like for my brother who was applying vet school, which is very competitive, Dr. Crowley told him, do a master's, because you're not going to get it in the first year with your GPA. And he did, and he got in. So, I think that is a big thing, and even though I didn't intend to do a master's in between, that was the talking point of every interview I did, was my master's experience. So I think, if you happen to do something different, if you travel in between, if you do something outside of the book, talk about that, because they get bored of talking about the same things every time. And that's what they would tell me, like, we look for something on our application that's different than just what you do in your grad, So I think if you happen to not follow a traditional path, then talk about it.
I can add to that. The average age of students in my class when we were freshmen in dental school was 25. So I was one of the younger ones in my class, because a lot of people did something different in between. We had some military and master's program people, and it's not that it's really common to be older, but the average age was 25. So.
One more thing, I just remembered. Remember who you interview with, the names of the people that you interview with, and send them thank you cards, personalized thank you cards.
Right. I'm going to have you shift to your actual professional school program. What was the biggest surprise? Talk a little bit about what the program itself was like for individuals who maybe know what they've read, they know how many years it is, they know some of the basics, but what are some of the realities that maybe they wouldn't know from just introductory conversations?
I had a big surprise. I had a baby in dental school. That has nothing to do with the program.
It could happen to you.
It happens, and you can survive it if it happens to you.
Survive and thrive.
Yes. In a nutshell, PA school is 2 years, 24 to 26 months, depending on where you go. The first 12 months are your didactic year, where you are learning and studying, 18 hours a day. And then you go on rotations. Des Moines, it was excellent. I got to travel for all of my rotations. I went to 9 different states in 12 months, 4-week rotations, and they were more family practice oriented, so I did 3 family practice rotations and 2 internal medicine rotations, which were not for me. And no orthopedic rotations, which was really interesting. I actually hated orthopedics, to tell you the truth. That was the first test I failed. Yeah, I did. General surgery was where I was going to go, the whole time. And go figure. I love orthopedics now. But yeah, so that's how PA school is divided up. 12 months education, 12 months rotation, and I think you learn just as much or more on rotations than you do in the classroom. Your best day in the classroom is still not as good as your worst day on rotations. And that's the truth.
Did they do PBL at SIU Dental School? Problem-based learning, or that? No. I'd say the biggest surprise for me was SIU. Did you do that, Washington? Yeah. the biggest prize for me was problem-based learning, which SIU is actually the national world lead. One of the things they hang their hat on. And problem-based learning is exactly what it sounds like. You give a problem. So we come in the first day, there's 6 of us sitting around a table. It's like someone comes in, shortness of breath, whatever, describe the physiologic learning issues and go learn about them. And I'm like, I want my money back. You know, I mean, this is like, you know, Sally Struthers, learn by correspondence.
Somebody had to be the timekeeper.
Yeah, like what's going on? Like, yeah, and then you know, we all have been in groups. The guy that comes in, like, that's your learning issue. You know, you gotta learn whatever they're gonna teach, because you didn't teach me what I needed. But it was, to me, the non-didactic lecture was really hard to adjust to, but extremely valuable for me later in life. Now, I have a problem. It's pediatric proximal humerus fracture, 13-year-old. This happened to me 2 days ago. And what do? Well, there's not someone that's going to lecture to you about what to do. You have to go out and get that information, figure out where to find it most efficiently, learn the information, disseminate and practice it. And to me, that was very hard to pick up, but very important for me to do that. And we actually had 2 tracks, and you could choose. The guys who were in lecture all day were just like so stressed and pissed. And it was harder because I was constantly worrying, is this a Swiss cheese thing? What am I missing? What learning issues do we not cover based on this problem-based curriculum? And we all ended up at the same spot, but you got to look at the school that you go to because it's a different deal. I think almost every school now is incorporating that. I know SIU PA school, my PA went to SIU and he was like, yeah, that's all right. That's how they learn.
Any suggestions on non-science courses that you would recommend students take?
Medicine, business.
Yeah.
If you could take an insurance coding class.
I thought it was useful that I could speak Spanish because I was one of 2 in my class that could, and we got all of the Hispanic patients that couldn't speak English. So that was kind of fun. So if you can speak another language, you might be able to use it later on.
So pick that up.
Yeah,
And
so
present
do
that.
No, I would say actually that's super valuable, Spanish in particular, yeah. And I guess I would just say, maybe anything non-medical, I actually think is really good. I'm kind of sounding like the free spirit here, but I mean, like, I think, you know, again, I can't say enough, I think this is also valuable to your future life. That, like, your life is so busy, no matter what, it's busy now, and like he said, from 18 to now, it's been crazy, right? I mean, it's just, and then you add kids and you add other things, and you don't have enough time. So I think you do have to figure out ways to still think creatively, and music, I know you were talking about music is a huge thing, you know, sports, something that's outside of just, because you'll think better in your job if you've had time to be outside of medicine.
The biology bubble.
Read some books, get, you know, whatever it is for you. I think that is so important because that's a practice you want to continue into your life.
I took a class here called Rights and Wrongs. It was a philosophy class. I really liked that because it made you had to choose a side of like really controversial topics. Yeah, it was kind of fun, and you have to do that a lot in your careers. Like, not all dentists would choose to treat the tooth the same way, so you have to learn how to defend your position.
Dr. Clapp still here? Philosophy? Was he here when you got here?
Mm-hmm.
To your point, I had, I took a couple classes and it said, pick whether or not God exists and defend it in the paper. And, you know, this is stuff that, you know, only Wesleyan's going to challenge you with, which is, I think that is, to your point, it is certainly, I took an acting for non-majors class in the intern, and I honestly almost changed. I was still wanting to go to med school. I just figured that would look better. You know, hey, I'm a theater major. I got all my prereqs done. I went for it.
Medicine includes acting, so that's.
Yeah, sometimes you're acting. And I hate to say this, and I don't say this tongue in cheek, I really think you need to enjoy a college experience and you have to interact with people. To your point about interviews, what I had a leg up on, because I was not as smart as everybody that applied. I didn't have as good as, I had really good grades at Wesleyan, but my test scores have never been like, but I knew if I got an interview, I'm good. And part of that, quite frankly, was because I drank beer with a bunch of idiots and had a lot of interactions with people to understand how to talk to people. I really think that makes a difference. I think in college, you got to experience college. If you come out, somebody who spent every second of their life just focused on the next thing, and I'm going to be a doctor, and you pick up on that right away, and you have to have some sort of social interaction. It doesn't have to be a sport, and it doesn't have to be drinking beer, but
And after track, I was a bartender for 3 years, and it was, I mean,
training.
yep, it sure is. So, bridge to an Eskimo. No, I mean, it's just, yeah, the personal relationships, I mean, you do make those with patients, you really do. Especially when you see people, what's your specialty?
I do medicine.
Yeah, so, I mean, you see these people on a very regular basis, and, you know, my arthritis people, I could, you know, sometimes they're like clockwork coming in every 4, 5, 6 months, and that's medicine too. That's a big part of it. See, I'll go be a bartender for a while. It's great.
They're not really.
We're never coming back up.
No, we wanted to hear the truth, guys. No, one of the things that I've noticed in my time here, which has been a good number of years, is that we used to, and we still do, have many, look at the hands that went up, many of our students who want to go to medical school. But one of the things that has changed over the years is the number of students who are looking at PA programs, who are looking at other fields that perhaps they didn't consider in the beginning. So can each of you speak to kind of trends in your field right now that might be helpful for a student to be aware of, you know, if they're considering that profession? Is that a fair question?
Need to process for a second.
No problem, no problem. And then I'm, to let you, all of you know, I'm looking at the clock here, and I want you guys to have time for questions, so it's coming.
I think just briefly, I would say, you know, we're probably maybe not quite as much even as a specialist field, but definitely I would say there's a move towards having each physician team with either an APN or PA. And if not that, like in our clinic, because we're a little different, because we do a lot of teaching, we at least have like a 1-to-3 ratio. So I think it's a huge, huge benefit, and I think we all can't deny that not just in the U.S. but globally, there's a huge shortage of healthcare workers and especially physicians, especially specialists. So at least globally. So I think, you know, I think it's really important that we look at task shifting, and not only here, but again globally. I think that needs to be a big move, and I think we need to do it creatively, because we can get really rigid in our training methods and think that things have to be, you know, you have to go through training in this way to be effective. But I think we can look at how maybe in areas of shortage, we can do training that's more brief but more pertinent to what is needed in that area. So I think this is an area actually for a lot of innovation in the future, and I think we have to do it. We don't really have a choice because the need is out there and there's a shortage. So I would just say I really enjoy working with our APN and enjoyed all through residency, working with PAs and APNs, and so I would say, yeah, it's definitely an important part of our job.
It's the fastest growing profession in the world, and I think that's for good reason. I always look at it like, what would I tell my children to do? And people say, oh, would you ever tell your kid to do it? I love what I do. I mean, I'm sure that it comes out. So of course, if that's what my family, my kids want to do, I think it'd be great. But if you really dissect it down and you look at what time you commit, you have to consider finances. You have to. For your family someday, you're foolish not to. And you say 2 years of commitment for a good living with very limited liability. The buck stops with me. But my PA runs my practice. I was telling Annie, it changed my life. I was on call last weekend. I spent the entire weekend with my family. And my PA did consult notes, and he loves to do it because we have a great relationship. I respect him, and I treat him fairly. And the team together is huge. I think he loves his job and life. He gets technical. He closes for me. He does procedures. But he doesn't have to go to school for 10 years after college is over. And he gets paid well. It's a great job that can support a family. You know, when you really dissect it down, we do need it. It is invaluable, and I would completely encourage someone to go that route. Having said that, I couldn't do it. And you got to know your own personality. I need the buck to stop with me. I like it. I want it. I want to be the guy in the room that makes the decision. I like that. If it was, what do you think? Should we? No, I'm gonna decide how we repair this thing, and I'm gonna do it technically. And I wanted to do that, and I wanted to spend 10 years to understand how to do it. But that's not good or bad. It's just knowing yourself, I think. But I am a big PA fan. I want more. If I could.
And you can't run the practice without.
Yep, there it
is. Which, as a therapist, you have the ability to be all in. You can be full-time research. You can be part-time. You can work a day and a half like I do, which I tell people all the time when they grow up they should be me. That I love my job. I help people. I know when someone sits down in my chair, when they leave, for the most part, they will be better. But on 2-3 days a week, I know that I will pick my child up at school and I will take them to their activities, and I will, I have the best of both worlds for me, that I get to be a mom and a therapist. And that's what directed me from being pre-med, I'm going to go to medical school, that and Bruce Criley, but we've talked enough about them. And the other half of the dream team are who said, have you ever thought about being a therapist? Let's look at PT, let's look at OT, let's look at PAs weren't really around in 93, 4, 5 when I was making decisions. I think it might have been a path I would have followed, but at one point in my career, I thought about going back to school when I was 30 and didn't have babies yet, and thought, wait, I went this path for a reason, and here I am, and what would I want to be? I would want to be a hand surgeon. I would want to help hand patients. I would want to be me. I like what I do, and I've worked full-time and I've worked part-time, and the therapists have some autonomy. There's a great movement at our office right now that I think is so cool. The doc sends the patient, the ambivalent teenager with shoulder pain, and they come through the clinic and get put through this movement analysis, and they say, you have tight hamstrings and your hip flexors are in trouble, and there's that whole piece, and you have a parent going, what? She said her shoulder hurt, and they say, well, if her shoulder's not right, because her hips aren't right, because her knees aren't right, and it's such a fun. There are lots of pieces of the medical puzzle.
On the PT front, just to follow up with that, number one, I can't believe I missed out on saying the PTs were also a lot of part. I'm very sorry.
Well, I'm not a PT. So
my mom is a PT, a therapist in general. My mom's a PT, my wife is a nurse, so at the dinner table, it's like, I really made that patient better. And then my wife was like, your nurses really take care of people. And I'm like, I don't even know what I do anymore. But they're right. And just to, I think if you really look to the future and look around corners, to me, I want, and our therapy is starting to go that way, the therapy department is the center of really a wellness, and that's a buzzword, but a wellness and an overall caring of patient type of platform. We have a continuum of care. These are all buzzwords you guys will get nauseated with eventually. But there's episodic care. I see you, I treat you, you're gone. But then we can't do that anymore. It's a continuum of care. And even from a specialist point of view, we need to look at it more like a therapist comes in like, yeah, okay, you have shoulder pain, but you're morbidly obese and we have a metabolic test that we're going to do for you, and then we're going to put you through a low impact exercise program. Because wherever they plug into a system, that therapist, that practitioner, that PA, that orthopedic surgeon, I think it's your duty to help them. But there's so many ways and so many people help them, quite frankly, more than I do.
Yeah.
For sure.
All right, what do they want to know?
All right, we're gonna turn, okay, I know you come in with questions for us. Here's your experts. So what questions do you have? You can direct it to an individual or to the panel. Just takes one. Rock.
I have a good transition question kind of on this topic for all of you. What direction do you see healthcare evolving towards in the future that we should be knowledgeable of going into the field now?
The use of PAs and nurse practitioners and therapists, and like it's so much more, not episodic anymore, but what was your other word? Continual.
See, I might be in orthopedics, but I'm also I'm keeping an eye on that hemoglobin A1C. Because boy, if you want that hip replacement, you got to get it down. And okay, let's talk bariatric surgery. If you are morbidly obese and your BMI is just not at that level where we can make you safe for surgery. Or let's get you in a good nutrition program or a low impact. Let me get you with a therapist that can introduce you to. So we are truly the gateway to managing these folks and their chronic diseases, and just let me go ahead and tee this up for you when they're ready for surgery, and that's my job.
I don't think the doctor gets to drive, like it's no longer all about what the doctor says is right anymore. Now you have to deal with what the insurance company says you can do, and did you follow the right path, and have you done the right tests, and so that goes to the business aspect of medicine.
And I think I would say, maybe from a different perspective, that population health is probably going to become a much bigger thing. And I think we're already moving that way, but I think, yes, each patient encounter is super important, and that patient-doctor relationship or patient-provider relationship is super important, but we kind of know that we're behind the ball. Like preventive health, we're not doing a good job. And I think, at least in our country, I think population health is going to become a bigger issue. So kind of how do we interface with the community as medical providers or just health providers? How do we interface with public health, and even how do universities interface with the community and medicine? So I think that is going to be an important place for movement. And I know I've used this word a few times, but I think the other big thing I think of is how innovation is going to affect medicine. Because I think, again, we know we have these huge issues in the U.S. and globally. And I think when we think about health disparities and we think about just how far we have to come to meet some of these needs, I think we need you guys to be really super innovative and come into medicine and be able to think outside of that box of just that one patient-provider encounter, which again is the building block, but it's not going to be everything because we won't get there fast enough. So I think that's what I think of.
The only thing I would add is, when I was going into medicine, we said you should never do this. This is not what it used to be. Insurance companies dictate what you do, and a little bit of that's true. It really is. But this is how I grew up in the medicine world, and this is kind of what I'm used to. I get on a peer-to-peer, is what I do. If you had to do a peer-to-peer 20 years ago, people would be like, I am quitting medicine.
Yeah.
But the most important thing for me, I would say, is not the insurance thing, because you're going to grow up in it, just like I kind of have. EMR is not a scary thing, like we grow up in it. But outcome measures is going to be your buzzword. You're going to be rated on your outcomes. You're going to need to know your stuff. You're going to have to treat people well. Or you're not either going to get paid the same, or you're not going to get patients, or somehow that will have a negative impact on you. But with every maybe discouraging or detracting portion, I think that's a huge positive. If you know your stuff, you guys are all very sharp. If you know your stuff and you're on top of your game, you're going to be the busiest time. Because outcomes are going to be rewarded. It's not going to be, he's really nice, or no, this guy does a nice job. And so, but that's where it's coming to, I think, especially even on insurance plans and what are your outcomes? How come you can't do a total knee? I can't do a total knee on someone who's over a certain weight, because we've proven outcomes are not as good. And the hospital won't even let it. So that's a little bit, that's a change. That's a,
The transparency factor.
yes.
Yeah. Mhm.
Yeah, we don't make all decisions based because this is what the doctor wants.
Yeah.
And that's okay. As long as it's rooted in good fact and science, I think that's not a bad thing, but you gotta be ready for that.
What else?
This one's specific for Dr. Norris, and I mean everyone's been helpful, but it's really specific to SIU
Okay.
Medical School. So you clearly didn't go the internal medicine route when you went to surgery, but I've heard mixed signals about SIU and how it's rare that they prefer people to go on outright just tell them that they don't plan on going to internal medicine. But you mentioned playing the game earlier, and what if you're in a position where you might not be leaning towards internal medicine, but would it be better in your outcome to kind of maybe fake a bigger interest?
My short answer would be, and don't take this away, don't think you know what you want to do. Because I did go in knowing I was going to do my peds. 100% sure. I followed Paul Peterson in town here. He convinced me to go into medicine. I wanted to be him, but I wanted to do peds too. Because I wanted to be Encyclopedia Brown and the toughest cases, and I will solve them all, from kids to the grandparents. And I got there, and I just wasn't that guy. And you don't know who you are. So I don't say that because to say, don't hold on to the dreams that you have right now, but you're not lying if you really do take an open-minded approach, and you really should. So I would say, I'm open, or I'm whatever wording you want to use, but I think it's real. Because my advice to everyone is, don't think you know what you're going to do in the next 7 years. You could be a neurosurgeon, or you could be in the World Health Organization. You don't know. You're going to be empowered and motivated and inspired by something, and it hasn't happened yet. When you get to med school, it really happens.
Other questions? Yes. My question's for Dr. Nord. Would you be able to talk about how you kind of acquired your own practice and that sort of transition stage for you? Because I've actually never heard of someone so young owning a practice.
Yeah. When I was a junior at Illinois Wesleyan, there was a dentist who went to Illinois Wesleyan and sat on this panel, and Dr. Mohan, you guys know him? He apparently was at the panel. I wasn't, but he told me, hey, there's a dentist that you should go shadow. And I shadowed him, and I told him for dental school I needed like 100 hours of shadowing, or I think that's what one of the schools recommended. And he offered me a job for the summer to work as like a second assistant. So I was a dental assistant between my junior and senior years here. And then he was just my mentor the whole time I was in dental school. Anytime I had a question, I'd ask him or tell him how things were going. I always checked in with him and go to lunch when I came back to town. So I just kind of maintained that relationship. Always thinking that maybe I would work for him one day. But then I asked him one day when I was a junior in dental school, so where do you see yourself in like 5 years? He's like, it's funny you should ask that because I have 3 offers on the table to buy my practice. And I kind of freaked out because I always thought that was going to be my job, was working with him. So I think I like called my dad. I was kind of disappointed, and he goes, why don't you buy it? It's like, because I'm a dental student, I can't buy a dental practice. And he goes, why not? And I thought, okay, why not? And then I just started talking to a lawyer and an accountant, and we figured out that it would work. And so I put another offer on his table. And we just had very similar philosophies. I think it's important that if you're going to try to, I don't know, work for somebody or buy their business or whatever, that you have the same philosophies about life and about your practice, I don't know, dental and medical, whatever, that you want to treat patients the same. And if they're on the same wavelength as you about those things, then I think it's a good person to have as a mentor or to take over their practice.
Other questions? Yes?
This is kind of also aimed at Dr. Nord in terms of, so when you're trying to acquire stuff like under your college belt, when you're applying to dental schools, obviously certain things are a little bit more expensive in terms of going, so of course like all the medical brigades, like going twice is a fantastic opportunity on both occasions.
Yeah.
But when you are applying, do you know, I mean of course I'm sure like in dental school you're not like, hey I went to Mikara, or like, hey like, did you go here? But is that something like if you are not able to participate in that due to, like for example, I'm one of 4 younger boys, so
Yeah.
trying to handle that kind of a situation would be tough.
Uh-huh.
So is that something that, like if you don't have that, is that automatically like kind of like a black check mark against you?
No.
Or-
I don't know of too many of my classmates that did do stuff like that. Trying to think what things. I just tried to be involved in as many things as I could, and I think that having a job over the summer really helped me. But shadowing and learning specific skills, maybe like lab skills. Dental school is a lot of hands, using your hands and learning new things. But I think you could shadow a dentist and ask them all kinds of questions about how to make a model of somebody's teeth. I mean, you learn that one of the first days in dental school, but a lot of people I went to school with didn't know how to do that, and I did. So I think just learning little things from a dentist might help you.
Good questions. What else? Yes?
Mine's for Dr. Marshall. So for doing.
Oh, I'm just Annie.
Okay. I asked her, I was like.
Nope, you call me Annie.
Okay. I know for a lot of PA schools, it's typically around like 2,000 to 2,500 clinical experience hours. Could you talk about yours and if you have any suggestions for what to do? And also, I'm pre-PA and considering a gap year to get all the hours, and if you would suggest that.
Absolutely. And actually, I apologize because my hour requirements were much different than yours. They've changed. Even in the short time since, I've been practicing, my shadow hours, patient contact hours, I worked as a medical office. I just filed stuff. And I got to shadow surgeries in the morning and come in and, assist with little procedures in the office with the general surgeons that I ended up working for here in Bloomington. But I did that for 2 years, 2 summers and then a whole year after school. So that ended up being, I think mine were only 750 hours is all I needed. And that qualified as patient contact. That would not qualify as patient contact hours now. You need to be a CNA, you need to be a medical assistant, you need to, and in fact, we would always joke that all of the great medical assistants that we had at Carl, and even at Kirby, we just lost one, they go to PA school. Because they're engaged and they care and they want to learn, and they're, those are the folks that we miss the most. But they go on to do great, that's not the end, that's not their end of the road. With some exceptions, of course, but we do miss ours that are in PA school now and that are PAs elsewhere. So that would be my suggestion, is take a year off, be a medical assistant, be a CNA, because you are going to get a lot of great experience. There's nothing wrong with being 25 in PA school. Nothing wrong.
Describe
That's
the
what I was
work.
just going to ask.
I think I've heard it does. facility, because a lot of people do it.
What's that?
It was that, like, be a scribe.
Oh, yes, right, yeah,
That's a
absolutely.
new, that's a new
But I don't know if
trend.
At
It's
MCO,
healthcare.
positions are open.
But does that count as patient contact?
That's my question,
Is-
I don't know.
Yeah, I don't
Some
know.
places do, some don't.
Okay.
Schools are like super varied. Some like say don't have 5 hours, some say 500, some say like 2,500.
It's getting higher and higher. I mean, I think that they're wanting a year of that experience. And somebody said it earlier, I think you did, just so you know that that's what you want to do. And of course, if you want to be a PA, go to an office and be a medical assistant or scribe in an office that has PAs. So you know, you get good experience there.
Do you guys know what the scribes are? You know what we're talking about? Okay.
Abby?
This question is for Andy as well. So I'm working with a lot of students who are doing the group interview experience, and you referenced that briefly, that it was strange and awkward. Could you elaborate on that a little bit and what that really looked like and the best way to prepare for it?
Yeah, you got to know your audience, and mine was a Chicago audience, and you know I'm a I guess a country girl from Normal, Illinois. We're not, but we're seen that way. And you know, I did not give Miss America pageant answers, and I think that that's what they were looking for. And you know, the last one they said, you know, kind of off the record, you know, not really a question, but we just want to know, you know, if you weren't going to be a PA, what would you be? And I said the pitching coach for the Chicago Cubs. And they just like looked at me, you know, because everybody else was like, I'd be curing TB in Africa, and I'd be doing this and that and the other. And I went last, and I said that, and I'm pretty sure I blew it back. But it was, you know, we had some really opinionated students or applicants in my group, and you know, maybe I just didn't have strong opinions one way or another, but boy, they kind of, you know, what do you think about universal health care, and what do you think about this? Like, I just want to go to PA school, like, you know, but I did not have strong convictions about a lot of things that they were asking about, and maybe because I didn't know myself, but maybe because I just got a little nervous, but.
And what was it like? You, 5 other people,
It was
and
me
then
and 10
so
other people.
10.
There were like 12 of us
Okay.
in a circle, and then 3 or 4 applicants, or 3 or 4 interviewees.
Okay, and then you all answered the question right there in front of everyone, and you would piggyback off each other. Were there any group tasks? I've been getting a lot of people assigned, like in the MMIs, from everything from PA to pharmacy to even dent. Like they have to do like group thing, like did you have to build a tower or you know anything like that?
Escaping from a room? No.
Yeah.
I remember we had to write an essay. We had to write 2 essays that day. It was an essay, and then a group interview, essay, final group interview. Strange. I won't tell you what school it was. It was a Chicago one.
So it goes back to people skills. You need to be able to talk to people, whatever kind of people.
Yes.
Eye contact and.
Something I didn't realize when I was being interviewed is that the student that led you around to all the different parts, I mean this happened in a couple of schools, they would give you a tour or take you from this interview to this interview or whatever. Their opinion of you mattered, and they would tell, you know, the interviewers what they thought, and so just because you're not being interviewed at the moment, you kind of are. So get along well with whoever is giving you a tour.
What else, folks? Okay, some of you probably have individual questions, but let's give a warm thank you to we realize that all of your schedules vary, so we understand if some of you need to depart, but I'm guessing there will be some students heading up your way. So if you have individual questions for some of our professionals, here's your opportunity.